Hello, in this video we are going to talk about the veins of the face and the neck, and we are going to discuss roughly point 237 that is related to the veins of the face and the neck. First of all, let's recall all the names of the veins that are involved in face and neck. So there is facial vein, there is superficial temporal vein, maxillary vein, retromandibular vein, internal and external jugular vein, and subclavian vein. So first let's talk about the facial vein. Facial vein is formed at the medial angle of the eye by the union of supraorbital and the supratrochlear vein. Through the ophthalmic veins, it is connected with the cavernous sinus. It descends down the face with the facial artery and passes lateral to the mouth and crosses the mandible and joined by the anterior division of the retromandibular vein, and then they drain into internal jugular vein. So anterior division of the retromandibular vein along with the facial vein drain into the internal jugular vein. Superficial temporal vein and maxillary vein, their union form the retromandibular vein. So a superficial temporal vein is accompanied by the superficial temporal artery and the auriculotemporal nerve, and then this enters the parotid salivary gland where it joins the maxillary vein to form the retromandibular vein. The maxillary vein is formed in the infratemporal fossa from the pterygoid venous plexus, and this joins the superficial temporal vein in the parotid salivary gland to form the retromandibular vein. Retromandibular vein has two divisions, the anterior branch and the posterior branch. The anterior branch join the facial vein whereas the posterior branch joins the posterior auricular vein to form the external jugular vein. Retromandibular joins which vein to form the external jugular vein, that is the posterior auricular vein, and retromandibular vein formed by the union of the superficial temporal and maxillary vein. External jugular vein is formed by the union of posterior auricular vein and the posterior division of the retromandibular vein. It descends across the sternocleidomastoid muscle and beneath the platysma muscle and drain into the subclavian vein behind the middle of the clavicle. So if there is an MCQ that regard tumor compressing the anterior surface of the sternocleidomastoid muscle, which vessel is going to be engorged, then the answer is going to be external jugular vein as it descends across this muscle and beneath the platysma muscle. Now the internal jugular vein, that is a large vein that drains the blood from the brain, face, scalp and neck, and it starts as a continuation of the sigmoid sinus and leaves the skull to the jugular foramen. It then descends through the neck in the carotid sheath, and the vein lie lateral to the artery and the vein both in the lateral to the vagus nerve and the internal and common carotid artery, and then it is joined by the subclavian vein to form the brachiocephalic vein behind the medial end of the clavicle, and it is closely related to the deep cervical lymph nodes. So if there is an MCQ regarding internal jugular vein, so internal jugular vein starts from the ear lobule to the sternoclavicular joint. The MCQ that we have already discussed before in another video is the most immediate anterior relation to internal jugular vein after it exits the jugular foramen of the skull is via the internal carotid artery. Important to know the tributaries of the internal jugular vein. Facial vein is a tributary of the internal jugular vein, inferior petrosal sinus, lingual vein, pharyngeal veins, and the middle and the superior thyroid veins are the tributaries of the internal jugular vein. Now the subclavian vein. Subclavian vein is a continuation of the axillary vein at the outer border of the first rib, and the axillary vein is formed by the basilic vein and the vena comitans of the brachial vein. The subclavian vein then joins the internal jugular vein to form the brachiocephalic vein, and it receives the external jugular vein. It often receives the thoracic duct on the left side and right lymphatic duct on the right side. Subclavian vein lies in the root of the posterior triangle of the neck, and it is used for the cardiac catheterization. So this was all about the veins. We are going to discuss the lymphatic drainage of the head and neck in the next video. Thank you for listening.